Didi, please check WhatsApp.
Deepta Shikha, can you hear me? Let's call him. Call her.
Good afternoon, everyone. We will start in few minutes. We are participants are still joining. So maybe let's wait for another 5 minutes. Do you think will it be okay? Dr. De?
Yes, yes, yes.
Okay.
Yes.
Our panelists are here.
Yeah.
I can see both of them. Yes.
Please ask participants to rename themselves. If they are joining with some other names, please ask them to rename themselves.
Something important.
Yes, so requesting all the participants, so please join using your own name. It will be really helpful for us. And we have given you the permission. If you have joined already with some other name, please rename with your own name.
People are joining, so it's better to wait for 3-4 minutes.
Am I audible? Yes, you are audible. Yes.
ম্যাডাম ভালো আছেন? অবধি ম্যাডাম
Ma'am, you are mute.
হ্যাঁ স্যার
হ্যাঁ গুড আফটারনুন, ভালো আছেন তো?
হ্যাঁ ঠিকঠাক, আপনি কেমন আছেন?
হ্যাঁ চলছে।
এখন it's now raining, that you are much better now.
That's true.
I think Ms. Chakraborty is facing some problem with the network. Dr. Dev, please unmute yourself.
Should I call her?
Yes, I think she is facing a problem. She was here, but then she
Okay, I'm calling.
left the meeting. Requesting once again the participants, so please rename yourself. If you have joined with some other names, kindly rename yourself. It will be easier for us then. to conduct this program very smoothly. It's a
I just
request.
had a talk with Ipsita. She is joining.
Okay, fine.
It's just because of some technical glitch,
Yes,
network
okay,
problem.
okay. So maybe we can start in just another 4
So
minutes.
now, once she joins, I think we can start
Okay.
and let other people join on.
Yeah, she is waiting. Yeah.
Dr. Alok Kumar sir and Ipsita madam, can you hear us? Both of you?
Yeah, I am here.
Okay, sir.
Okay.
And Ipsita,
Shita,
I'm not being able to hear from her.
she is here. Ipshita, am I audible to you? Ipshita, am I audible to you?
Yes. Can you hear me?
Yes, we can hear you.
Can you hear me?
Yes, can hear you. Am I audible to you?
Can you hear me?
Yes, we can hear you.
Maybe she is not being able to hear us. Yes, I just had a talk with her because of some network issues. So let's start, Purva. She is joining from another device, and till
Okay.
then we have Dr. Alok Kumar sir with us. Dean sir is with us, and
Okay.
participants have also joined. So let's start the program.
Okay.
Let's talk about medical physics now.
Okay, fine. So, respected Professor Bimal Kumar Sarkar, Dean School of Basic and Applied Sciences, our esteemed panelist, Ms. Ipsita Chakraborty, Medical Physicist and Radiation Safety Officer from the Department of Radiotherapy, Medical College and Hospital, Kolkata, Dr. Alok Kumar, Senior Consultant and Chief Medical Physicist from Netaji Subhas Chandra Bose Cancer Hospital, Dr. Momita De, Head of the Department of Physics, all my colleagues and all the participants on this virtual panel discussion. A very good afternoon, everyone. So as one of the coordinator of this organizing committee, I, Dr. Purva Bhattacharya, welcome you all to our panel discussion, Empower Your Future Post-MSc Diploma in Medical Physics. Let me take this opportunity on behalf of the committee members, the Department of Physics, and personally to wish you all a very warm greetings. So pursuing a postgraduate degree in physics can open up various job opportunities across different sectors, research scientists, data analysis, teaching, and academia, and many more. But today, we are thrilled to host this panel discussion on the promising avenues awaiting those who venture into medical physics and radiation safety officer role after pursuing a background in physics. So without further delay, may I now request Professor Bimal Kumar Sarkar, Dean, School of Basic and Applied Sciences, to say a few words.
Thank you, Purva, for your kind word. Really, it's very great moment. Great moment in the sense, I think this is the first time we are talking something about this program, post-MSc diploma in medical physics. And it is the first private university in West Bengal to open this program. And importantly, jointly with Netaji Subhas Chandra Bose Cancer Hospital, Kolkata, and it is recognized and approved by the AERB, Atomic Energy Regulatory Board, Government of India. So this is therefore this is the precious moment for the department that we started some talk on this program, and I think now onwards the program is started. So in that respect, today we are very fortunate enough that among us, Dr. Alok Kumar, Senior Consultant and Chief Medical Physicist, Netaji Subhas Chandra Bose Cancer Center, and Ms. Ipsita Chakraborty, Physicist cum Radiation Safety Officer, Medical College and Hospital with us. And obviously, they will share their much big experience with us so that the audience can know that what is the scope, prospect of this program. Because I believe that today in healthcare, the number of the medical physicists which is required is not sufficient to be supported. And in view of this above context and scenario, obviously, the Department of Physics, Adamas University, will be contributing a lot to this aspect. And really, it is very auspicious moment and auspicious initiative taken by the department so that the society will be benefited, the community will be benefited. Why? Because the people who will be graduated from this program, obviously their expertise, their knowledge will bring the outcome to contribute in the healthcare in the society. So I'll not linger on this discussion much because rightly we have with us today very invited, experienced scientists, physicists, medical physicists with us. They will just enlighten the session, and I hope and I wish the grand success of today's event. Thank you very much, and over to you.
Thank you so much, sir. So now I want to request Dr. Momita Dev. Can you please talk about what is basically the medical physics? And in this discussion, can you please say a few words on the new program, the post-MSc Diploma in Medical Physics, that is being offered from the Department of Physics for the first time?
Sure, Purva. So am I audible clearly?
Absolutely.
Okay. So first of all, good afternoon, everyone. Thank you for joining us on this very nice afternoon, and whether you are joining a lecture to listen to medical physics, that's commendable for sure. So thank you very much for joining that. And let's talk about medical physics. Well, I'm not an expert on medical physics, so obviously I'm not going to say about the details of medical physics. But as a head of the Department of Physics, let me say one or two lines about it. So medical physics is basically a concoction of applied physics and medical science, you can say. So the program, whether it's a MSc in medical physics or PG diploma in medical physics, which is being opened in Adamas University, this program basically creates highly trained professionals who applies the principles and techniques of physics to the field of medicine, particularly in the areas of diagnosis, treatment, and research. Now, these professionals play a very crucial role in the safe and effective use of radiation in medical imaging, such as X-ray, CT, etc., and radiation therapy for treating cancer and other diseases. So I won't be saying much about it because Dr. Alok Kumar and Ms. Ipsita both are experts in this field, and they are going to talk about it in details. So as Dean sir said, that with this thought keeping in mind that there is ample job opportunities right now with a very bright career option. In Department of Physics, we have decided to open this program from this academic year, and we have opened it in collaboration with Netaji Subhas Chandra Bose Cancer Hospital, which is in Goria, Kolkata. And for internship, we have done we have signed MOUs with both in NCRI, that is Netaji Hospital, and Nilratan Sarkar Medical College and Hospital. So this is all about the departmental initiative. And to know more about the program, I think it would be best to hear from the experts themselves. So over to you, Purva. I think let's now we can start.
Okay. So thank you, ma'am. Ms. Chakraborty, are you here?
Yes, I can hear now.
Okay, fine. So the first question to you, actually, I will once again ask you, as Dr. Dey have already said, can you briefly explain what is medical physics, and particularly what inspired you to pursue a career in medical physics or radiation safety officer after studying physics? Because as far as I know, you are a student of physics, right? So can you please
Exactly. Sure. Actually, first of all, good afternoon, everyone. When I joined this course, previously, I can say that from my childhood days, I want to be a doctor. But days goes on and I become a physics lover. But when I first my master degree in physics, then I heard about this course. And I do my research work on this field, what kind of job we have to do, what is the syllabus, and etc. Then I can understand that this field, that means this medical physics, can give me the essence of my childhood dream, and it will be able to bridge between physics and medical science. So I opt for this course. And obviously, when I am in this field, I can proudly say such a interesting field it is. Every day there are lots of challenges because everyone know that every patient is different. So when you treat a different patient different in each and every day, you can find challenges. And being a physics student, we all love challenge very much. So this field is very, very interesting. And also we have a noble chance to serve the cancer patient. Though we are physics students, still we have a chance to serve the cancer patient. So I opt this field.
Okay, thank you so much. So now my next question will be to Dr. Alok Kumar. Since we are talking about this post-MSc diploma course, so after completion of this course, will anyone get directly a job?
Good afternoon. Thank you very much for calling me here. At this moment, it is noon here. Actually, I'm in Italy right now. So anyway, it is good for me. Actually, this is a weekend, so I am out here and have the opportunity to talk with the people here. So you have asked me that what are the job opportunity?
Yes.
See, the application of physics in medicine in India, basically, I am telling you, it is a very fast. Not in India, even in throughout the world. If you see the application of physics in medicine, but for job opportunity is concerned, so basically we deal with the ionizing radiation. Wherever ionizing radiation is being used in India, so the role of medical physics becomes very much crucial. Because once you are using in the case of job opportunity, so radiation safety comes into the picture. So once you complete this such type of specialized course, professional course, this is a professional course. Frankly, I'm telling you. So once it is a professional course, definitely you have the job opportunity. So nowadays, once I joined this course, that time it was very limited actually for the job opportunity only in radiotherapy department. But after my actually career of 31, 32 years of career of the medical physics, I have seen it is a very, very, very vast opportunity nowadays coming up, and we can have a lot of job opportunity, not in the field of only in cancer, but in diagnostic as well. So, and lot of companies are coming up. Lot of companies, they are, just manufacturing the equipment. They have their own technology. And for the application specialist, only physicists are able to explain all those things, because the physicists are only can, if you say any department, wherever ionizing radiation is being used, so they are very, cumbersome, and they are very comfortable to explain all those, technicality part and radiation safety once you are using ionizing radiation in any equipment. So it is, I am telling you, day by day, it is very good job opportunity. In my case, once 30 years back, if I look back, that time only two opportunity was there, only research, or you doing the work in the radiotherapy as a medical physicist. But nowadays, diagnostic radiology, nuclear medicine, and those are, manufacturing the equipment. So there are a lot of opportunity has come up. So in my experience, I'm telling you, this is, God has given me such three, I have opened three courses. Jodhpur University courses, I have some opportunity. And then in Patna, Mahavir Sansthan, and the third one, where I am associated with you. And we are very much dynamic. I think all the department is very much dynamic. I have seen particularly Mamita Madam and new people are very much dynamic and very sincere also, I have seen. So definitely, this will the student coming up from this university will definitely will get the job immediately. Now also, there is almost zero unemployment for passing this course. Zero unemployment. Daily we require medical courses. Daily. And I am telling you, after opening the course in Jodhpur University, your West Bengal University is full of my students from Jodhpur University. Even if Ipsita is my student, she is also from Jodhpur University, and she is working very nice. She is very good, and she is working in the medical college. So, straightforward, they are getting the job. So now you ask question, then I can give you some particular answer and think. If Ipsita is also there, she can give you very good answer. But I am telling you, very nice, very wonderful course, interesting course, and it is direct application from physics in medicine. So now you can ask question.
Okay. Thank you, sir. I will come to you later. Yeah. Yes, sir.
Yeah. Since sir given an opportunity for some queries, may I, sir, ask one question? That since this is, after all, medical physics, so what will be your comments on the fact that being a physics person, is there any prerequisite biological knowledge required to continue this program?
No, not at all, sir. Not at all. Actually,
Okay, sir.
it is not required. Only physics required. Physics, understanding physics, good physics backup is always required, because
Okay,
it is
sir.
a totally application of physics only.
Okay,
And
sir.
slowly, during the course, we teach the student for radiobiology, the radiobiological part. For that, it is just for the treatment of the cancer patient, and wherever for radiation safety. So it requires radiobiology, and that we are teaching the student during the course. So after teaching the course, then only we have some intern program. So people will, the student will understand slowly and slowly. So not
Sir.
prerequisite, only physics. If we have good physics backup, then you will be a good medical physicist. This I can say.
Thank you, sir.
The
Thank you
only
very
thing
much.
actually, this is the only thing I recommended Madam actually, Mamita Madam, that take M.Sc physics, then 1 year diploma. So good physics backup, then 1 year diploma. So it will definitely, produce good medical physics.
Thank you so much, sir. It's very precious comments on this one. Yeah.
Thank you.
Thank you. So I will ask Dr. Dey actually about the eligibility criteria for this diploma course, since we are talking about only physicists can apply for this course. So is there any percentage in BSc or MSc that you have to get to apply for this
Yes.
course?
So according to ARP guidelines, so we have set up some rules that the eligibility criteria is basically you should have a BSc physics degree and you should have a minimum of 55% at MSc Physics level, but your degree should be only MSc Physics, no other, just like MSc in Applied Physics or nothing will work. So it would be MSc Physics with 55% marks. So that is the eligibility criteria. However, eligibility criteria doesn't ensure you with as the selection criteria. Selection criteria is different. We will collect all the application forms, then there will be a written test as is notified on the website. Our written test will be an MCQ based examination on 29th of June. Followed by the written examination, there will be a interview, and finally we will finally declare the list of 10 candidates who will be finally taking admission in this program. So this is the criteria. So basically the eligibility is you should have a BSc and 55% marks in MSc.
Okay. So no other physics program such as the radiation physics or something like will not be in.
Only MSc Physics.
Only MSc in physics. Okay, thank you. So may I now request Ms. Chakraborty, can you please discuss a little about some of the key responsibilities and duties of a medical physicist or radiation safety officer in the healthcare setting?
Okay. Actually, being a medical physicist, first of all, I point out the thing. If you pass the course, that means 2-year diploma in medical physics. If you pass the course, 1-year diploma and 1-year internship from a renowned institution having the prerequisite which AERB prescribed. After completion of the internship program, one is become a medical physicist. A medical physicist, when he become a medical physicist, he actually do 2 jobs. First of all, the treatment related job, and then in our medical colleges, what we do, we take some classes of PGT students. That means the MD radiotherapy students. We have to take the classes of them, and also the DRT student. That means the technology student. We need to take the classes. So this is the basically 2 part of work, and other than the administrative jobs, we have to perform other administrative jobs also. So we require to perform treatment related job, administrative job, and some teaching job. But in government sector, if you want to have a job in government sector, you must be a radiation safety officer. Radiation safety officer means after completion of your medical physics degree, AERB organize a all India basis examination. You medical physics students have to sit for the examination. He will get 3 chances to clear the examination. There will be 2 papers, each carried 100 marks, 100 marks written and 100 marks viva voce. You have to get 50% marks in each paper and in aggregate 60%. If you get the marks, then you clear the RSO examination. Now, when you become a RSO, that means the radiation safety officer, you have to perform some extra jobs. What are they? Previously, you have to make sure the radiation protection of the persons like patient, worker, and the normal people who are coming to the hospital. Not only that, RSO become a liaison person between AERB and the institution where he or she works. So, a physicist cum radiation safety officer will perform 4 kind of job: treatment related job, administrating job, teaching job, and most of all the job of a RSO, that means the radiation safety officer.
Hello?
Do you need yes? Do you need any other clarification regarding this?
No, I have some question in mind. So since you are talking about this RSO thing, so can you explain, is there any different type of RSO exam? Are there different type of RSO? RSO A,
Exactly.
RSO B, or something like that?
No, previously,
yes, please.
exactly. Previously, AERB used to give 3 level of RSO. RSO level 1, level 2, and level 3. Level 3 RSOs can work anywhere in industry and also in medical sector. Nowadays, AERB differentiate the classes. That means you have to sit for different examinations. For our case, we are RSO Medical Science or RSO Medical. So when we become a RSO, we can perform in hospitals. Not only that, we can join some companies also, like Varian, like Electra, Siemens, Philips. Here we can join as a R&D expert or some application specialist or to the back office support staff. But if you consider to join as a industrial RSO, then you have to sit for the another examination. You will be in a industry, your company will sponsor you to be a RSO. Then ARB will arrange a 7 to 15 days training for you and will provide a certificate. But we, the RSO level 3, previously we considered as a RSO level 3, now we are RSO medical. ARB conduct all India basis examination for RSO medical. You can be able to sit for 3 times. If you failure in your first attempt, then after 3 months, you can sit for the second attempt. But you have only 3 attempts to clear your RSO examination. So if you clear RSO medical examination, then you will be opportunate to take your career in hospitals as a radiation safety officer, or as I said, in some companies like Varian, Electra, who will provide you the machines for radioactive sources. Or not only that, you can join BARC also. You can join anywhere where the scientific officer is required. You can join as a RSO. But in Varian, there is also some engineers who are RSO, but for them, the required qualification is engineering, and then Varian will recommend him or her to be a RSO for their site. Then ARB will conduct an examination only for them, and they will pass it and become the RSO of that particular company, but not for us. This is not applicable for us. We are RSO medical, and we are the highest degree of RSO.
Okay. So in this context, since you are discussing these things, I have just another question in mind. So suppose you have told us already, maybe, but I want to get a bit clear view on this. Suppose I want to be an RSO in BRC, for example, in VCC or SINP, right? Because all these institutes need an RSO. So the exam will be the similar, right? And they will get the students can get the opportunity to join there as an RSO.
Can I give you this answer here?
Yes, sir, please.
Yes, sir.
Yeah. Actually, I'm telling you, we have the medical physics curriculum, and we are the medical physicists. So we are the qualified medical physicists. There is 2 categories: qualification and recognition. So suppose I am a qualified medical physicist. I am qualified medical physicist. I have passed my medical physics examination from your Adamas University. So university has given me, after completion of 2 years of course, 1 year diploma and another 1 year intern. So I am the qualified medical physicist. So I can work as a medical physicist anywhere in the world. But the recognition comes into the picture. So what is the recognition? So for the radiation safety point of view in India, there is a regulatory body. It is called Atomic Energy Regulatory Board. So Atomic Energy Regulatory Board will be recognized medical physicists to act as a radiation safety officer. But no employer can designate a medical physicist as a radiation safety officer. Only ARB will recognize a person and approve to work as a radiation safety officer in any institution or any department. You understand?
Yes.
So suppose I am the qualified medical physicist. Now what will happen? Then suppose you are my employer. I have passed. Now you are my employer. Suppose any employer. A, B, suppose you are medical institution or you are a industry, or you are diagnostic radiology, where the ionizing radiation is being used. Understand? So as an employer, you cannot work because you do not have the idea of radiation safety. So you will ask ARB, you will send my qualification, Dr. Alok Kumar, I have taken Dr. Alok Kumar, and he is having such a course, he has passed. So what happened? So because the person is passing from so many university has opened. So what they have done actually, they have filtered out actually. So all medical physicists is not able to work as a RSO because quality is concern over here. Because suppose I have passed, but I may be poor in my subject. So what they do, they take the examination. So they take the examination, and if it are told 100 marks, whatever. So after passing the examination, the Radiological Physics and Advisory Division, Bhabha Atomic Research Center, will conduct such type of examination, and 3 attempts are there. So I will appear there, and if I will pass, then only ARB will be recognized me as a RSO. Understood, madam? Is it clear?
Yes,
So
now it is
medical
clear, sir.
thesis I can work. Medical, so in any institution, only one RO is sufficient, one RSO is sufficient. But medical thesis I can work, but I cannot work as a RSO, radiation safety officer, because radiation safety officer is the liaising between ARB and the employer. Because the RSO will always assist the employer for the radiation safety, for concerning the radiation safety for the public, for the patient, for the radiation worker. All those jobs has been assigned to the RSO only. So RSO, this is the only one RSO required, and RSO has to pass actually. And now level 1, level 3, you have asked level 3. And now you have asked one question that if suppose in BRC whether I can work or not. So BRC you can work. Suppose a person is passed from your Adamas University. What will happen? They RSO certificate will only they will retain as they can RSO they can work in a medical institution. Medical they will write medical term over there. Medical. So once it is written medical, then BRC is not a medical institution. So they cannot work in the BRC. But the DRP means the Department of Radiological Physics from the BRC they have passed. If they will pass RSO in their certificate, it is written as they will work as a RSO in industry as well. So once industry research institution they will mention everything over there. Medical, research, everything will mention in the certificate itself. So it will be clarified that this particular student is eligible for institution for for medical or for industry or for research institution. So they will clearly mention. So nowadays what I have seen actually in their passing certificate, they are giving only medical and research. So once medical research they have given to the student, then they can eligible to work in a Bhabha Atomic Research Center anywhere. But they're going to work in a industry, particular industry where the NDT testing, non-destructive testing. So where the non-destructive testing are using that industry, our student cannot work over there. But Bhabha Atomic Research Center, those are passing from there, they can work because they are sending the student to the industry as well. So in near future, you can also do because you are having the engineering facility over there. So you can extend your syllabus next time so that it will cover all those areas. So in the industry, people also come and take the classes of the students, so they can eligible for all those areas. Is it clear now?
Yes, sir. Thank you so much for the clarification. Really, thank you.
Okay.
So, but to you, sir, once again, since you were telling many times the training is very important. So can I ask you what type of training the students will get during their internship? Because there will be the 1-year internship, right, sir, for this course?
Yes. So actually, as per the see, this is the all the syllabus and all the conditions have been imposed by Atomic Energy Regulatory Board. So this is their curriculum. So in their curriculum, they have written that these are the some portion that we have to cover in the internship examination. So generally, it is mandatory it is mandatory to have medical physics in a radiotherapy department. It is mandatory. So without a medical physics department, we cannot open a radiotherapy department. One RSO and medical physics required in a medical department of radiotherapy. It is mandatory. So here one job opportunity is automatically comes. So if you have 2 machines, then you require 2 medical physics. If you have 3 machines, they will require 4 RSO. If your number of patients is 500 per year, you require 2 medical physicists, something like that. So they have already given some criteria. So they have given some syllabus also for us to teach in the intensive examination. So they have given categorically very nicely that practical knowledge. Because we have given 1 year only theoretical knowledge. Theoretical knowledge means all this theoretical radiobiology and then accelerator, radiotherapy department. What are the syllabus is there? After completing this syllabus, we have to see the practical. This is nothing but it is the, I mean, medical physics, experimental physics, rather, you can say. It is kind of experimental physics. Means they will come, they will calibrate the system, they will calibrate the linear accelerator, they will calibrate the brachytherapy, they will do the daily quality assurance, they do the monthly quality assurance, they will go and treat the patient actually for, see the patient, how we are treating it, and how we do the planning so that the normal tissue for the cancerous cell is very sensitive sometime in the 70 to 80% cases. The cancerous cell are very sensitive to radiation. So, but in the same time, a normal tissue also we are killing actually. So we have to increase the therapeutic gain. Means we have to give radiation maximum to the tumor target volume, and we have to spare the normal tissue. So therapeutic gain has to increase. How to increase the therapeutic gain? So then for that we are doing some computerized planning, treatment planning. This is called treatment planning. So medical physicists go and do the therapeutic gain, how to give radiation, because radiation is unseen, nobody can see it, and doctors are basically they are not, expert in physics. So they do not know the property of the medical physics as what the physicists people can do, they are not doing actually. They do not know. So they 100% they are dependent on the medical physicists. So medical physicists will do all the planning. Then during that time they will learn how to do planning, how to do radiation safety, what are the steps required for getting this radiation safety. So all those things they will learn during their internship program. So after this internship program, so it is a big, long. Initially, when I was there a student as a medical physicist, I had only 1 month training program. So we have recommended actually. So we require more training for particular for the patient. Then only it will be understandable. So our recommendations slowly people are recommended. So they have increased to 1 year internship program. Or moreover, another thing is also there. Doctor are getting more salary than a physicist. Then there is some comparison. So we have a start comparison. They told you are only M.Sc. They have done MD, then internship, then this program. After that, they are getting this much of salary. So something like that. There is some equality. So they have given some internship program as well. So there are a lot of logic, lot of discussion we are there. So now it is 1 year, and definitely we require good training to the medical physicists so then they can educate themselves. Because as a physicist, I do not know where is the kidney, where is the but really I was surprised. For me, I am telling my experience to you. I was not knowing where are my body part actually as a pure physicist. But once we came here, then we have seen where is the thyroid, where is the kidney, where is the part actually, because we are treating it. So it will be very good and very interesting and challenging also. To definitely it is the peaceful use of radiation for the mankind. It is a very nice example, and job opportunity almost 100%. I am telling you, nobody in my knowledge is unemployed. Also, definitely nowadays, because a lot of university has come up, so it may be, but I am telling you, 100% job opportunity is still there, and the sky is the limit. So just because of medical physicists, I am here in Italy. So I am telling you. So just because of this, I am proud. I am a medical physicist, and still after completing my 60 year. I completed my 63 year. So still I have the job opportunity. I have a lot of job opportunity. If the people want to work, they can do whatever things I am telling you. So if you have any further question, please ask.
Thank you, sir.
I want something
Yes.
here.
Yeah,
Sir,
please.
Regarding the
I have one thing. You mentioned regarding a treatment planning. So the treatment planning is controlled by clinician or physicist, sir?
See, I am telling you,
For-
clinically, the clinical, when doctor will see the patient because the patient will come to the doctor. Okay. So the responsibility of patient, suppose anything is wrong, then definitely he will just go to the doctor. If anything right, they will pray to the doctor. And we are just like a mother. I am telling you, just like a mother. We are mother of the dental therapy department. So what the role of mother is doing, you can very well understand. And what father will do. So father is earning, so the doctor is earning, but the treatment planning, they do not know. The cooking father generally, father do not know how to cook. But they will definitely tell, oh, salt is more, salt is not there, it is spicy. They will complain to the mother. So, but this is the good mother. So we are mother. We are mother of the
Okay.
therapy department.
I understand, sir. You very nicely explained this thing. I
Yes.
think more than this is not required.
Yeah,
Very
so we
clear.
have medical physicist, mother. If you are good mother or bad mother.
Thank you, sir. Thank you.
About to say something.
point here, I want to add
Yes.
some point.
Yes,
With the
please.
medical field, the backbone of the department. Without us, no planning can be done. Basically, our job starts from when doctor complete their prescription and partly end when the patient is in treatment couch and technologist will deliver the treatment. So we are basically the backbone of the department. And I want to add one more point here that training is very, very, very much essential because in theory, when we are in the classes, when we are completing our 1-year diploma, we only know the theory portion. We know the physics, we know the medical physics, some radiobiology. But after that, theory, practical is very, very, very essential. Internship is very essential. And most of all, RSO degree is very essential. As Sat said, that sky is the limit for a physicist. Yes, it is so. But for the government colleges, if you want to be a government physicist, you must be a RSO. Because in our sector, in government sector, the name of our post is physicist come radiation safety officer. So we need to clear the RSO degree. In
Okay.
our medical college, we
One
are
minute, Ipsita, I will tell you one thing here actually. See, I will give you a lot of example. I think not telling about the West Bengal government here. So a lot of government institution, they do not require RSO, I'm telling you. They require only medical people. Okay. So I can give you a lot of example. Yeah.
West
So
Bengal government.
West
I
Bengal,
am telling
definitely.
you,
West Bengal, I don't know who had written come RSO. There is come RSO means RSO cannot be given by any employer. So RSO only is approved by ARB. Approval.
exactly, sir. We
So
are
approval
approved
required.
from ARB.
Yes,
We are
yes,
approved
yes.
from ARB, but employer will give the nomination
Yeah,
that
they are
this
there
person.
because this is
our-
a government. This is a government. We cannot say anything. Yes,
This is
but
government. This is government.
yeah. No, they are writing RSO, but I am telling you, suppose a medical physicist are there, so they can work. They are doing planning everything, but it's a part of the responsibility. There is a safety responsibility has been taken care by RSO. So I think even if you go in the Apollo, only 2 or 3 people are RSO, other are medical physicists. If you see a lot of hospital, even my hospital, if you see, only one RSO, 3, 4 medical physicists are working. They're getting
For
salary. So nowadays,
okay,
yeah.
there's one RSO or two
But-
RSO and others are medical physicists. But in our West Bengal government sector now,
West Bengal, it is like that only. Yeah. I
it
know.
goes like this. We
Your post is not like that. Yes. I know.
we only
I
34
don't know
because
why it is like this.
RSO. We cannot find a suitable RSO. That's why we are 34 out of 60. Government only employ the physicist with RSO degree. So RSO is very important.
Without your Jadavpur University, it was no physicist, I am telling you. You can ask Dr. Kapoor Kawasi. That time, so many IRB visited there and locked their, so many hospitals. Do you know this thing? Because without medical features, they were running, they were treating the patient. So they have locked ARB. So one, it is open. Now you are, we are fortunate that you people are there. So now you are very good people and very nice. Intelligent. All that. Where you are taking care of all the hospitals.
There are ample opportunities. First, students need to become a good medical physicist, and then they must try for RSO. If
RSO.
cleared,
Yes.
then good. If
Yes,
not cleared,
yes, yes,
then
yes,
also
yes,
there are,
definitely.
what I gather from Dr. Alok Kumar's speech, that if they do not clear, there are also ample opportunities to work as a medical physicist only. So yeah, you can continue to the next question.
Yes. So actually, my next question is to Ipsita. So can you share some or for the students and early career professional interested the career in medical physics or radiation safety officer, what advice would you offer to help them to succeed?
The only one thing I will suggest for them, that learn the subject very well, love the subject and learn the subject. Internship is very, very essential, because in internship, you can only understand how to do your day-to-day job. Besides your bookish knowledge, you have to apply your knowledge in the field of radiation. So my suggestion is, learn the subject and love the subject, and also follow the senior physicist who will help you to understand, because you think we don't have to actually when we are in the theoretical part, we exactly don't know how to do the planning. Our senior who are trained in this field, they will only help us how to do the planning. That sir has said that doctors will contour the target, and our job is to give the maximum dose to that target by saving the nearby organ or nearby normal tissues. So how to do that thing, that a student can understand when he is in his internship. So again, I am saying, my only suggestion, learn the subject, love the subject, and follow your senior physicist who will help you to understand how to successfully do your job.
Thank you. If here, can I ask you something? Can you discuss a bit on the salary structure in this field? I know it's a bit tricky question, but if you can give us just a hint.
Because for government, it is like an open book. Because when we start our job, we are in the field, in the government, we are starting with Group A gazetted post with a pay scale of assistant professor. And when we retired from our job, we are at the pay scale of a professor. Fine. But in the private sector, as Sad said, sky is the limit. And most of the time, maybe sky is not the limit. That much salary one can get if he is capable enough. You have to.
I am telling you, few examples in India. Yeah, it is. It is more than 1 crore, I am telling you, here in India, yearly, per annum. Salary in India, not mine, actually. I think very young people are getting salary. So it is, yes, 1 crore.
So,
1 crore per annum, yes.
So, sir, is there any possibility to get a job in abroad as well, since you are in abroad? So
Yes. But only thing is that, madam, actually, what happened? Suppose for European country or for Australia and for the US, you have to pass you have to clear their recognition actually. Okay, they have their own, examination. Then only you can work as a medical physicist. Okay, but where in the developed country, but in Gulf and other places where such type of activity is not there, then definitely so many medical physicists are working as a medical physicist in the abroad, and they are earning very good salary there. So I was also working Dubai also. So I have seen lot of medical physicists. They have passed from India. They are working and they are getting good salary in Dubai and other places. The only thing is that for that you have to be a good physicist.
Okay, sir.
Then yes. You have to give
Definitely.
examination, you have to give interview, you have to satisfy the departmental people over there.
Okay,
This is the case
definitely.
actually. Even here
Definitely.
I am working here in Italy. There is only one medical physicist, and she lady actually, she is not in the hospital. She is flying from some other places online and doing so many cases over there. So scarcity of medical physicists in Italy, I am telling you. That is the reason I am here. So they are the possibility I am telling you. A lot of possibility are there. Only thing is that you have to explore it. But this is a very good field. Simple M.Sc, people will not get such type of job, I am telling you. It's very frankly, I am telling you. So simple M.Sc will not give you such type of job, but medical physicist can earn. And really, I am telling you, sky is the limit. Government, good for the lady. I am telling you for Indian condition, but definitely it is a private job. As for me, I was working in the government. I have worked to government in Gujarat government also, and Indira Gandhi Institute of Medical Sciences, I have worked. Both the hospital I have left, I joined private because I want to work, I want to fly. This is my intent, and I am throughout the world I am working and doing job here. So there are a lot of example. I am a small person maybe, but there are a lot of people. They are doing very well in medical physics and they are earning good amount of salary. I'm telling you, very nice, very good field. But only thing is that you have to good medical physics. This is the only criteria. This is the only criteria. It's not like that you have passed medical physics and you will get very good job. You will get job, but if you want to fly, you have to sky the limit. Then definitely you have to good medical physics. You have to give examination. You have to give yes, madam. Yeah, yes.
Okay, thank you, sir. So, Ms. Chakraborty, can I ask you once again that, for example, if someone is interested to do research work or PhD in this field, is it possible?
Yes,
If
yes.
yes, then what are the options?
Obviously, it is the possible way to do your research work in this field. I can name one person. He is Dr. Biplab Sarkar. He is in Apollo Hospital. He most of the time, I can say, in every month he published a paper.
Wow, that's really
This
great.
is a vast field. Lots of data are there. As I said earlier, that every patient is different. So every patient data you have, every patient is different. Their anatomy is different, and every patient is like a data to you. If you want to explore, you have a lots of chance to do your research work, do your paperwork, and obviously do your PhD. Not only that, in different companies like Varian, like Electa, Siemens, Philips, they also appoint medical physicists in their R&D department. There also one can get a chance to satisfy his research-oriented mind. Lots of scope are there. This is such a nice field. If anyone will be in this field, he can experience such a nice thing. I cannot explain.
Thank you, ma'am. Really excited to learn about these things actually.
And
We
moreover,
didn't
I'm
know.
telling you, madam,
Yes.
I have produced 3% actually medical as a doctor. I mean, as a PhD.
Wow.
So one from one lady I is still doing from this. I mean, for Hyderabad University. So I am co-guide actually. I am not a direct guide because I have to be recognized from the university. So I am the co-guide, and for Adamas University also I am a co-guide of 2% actually. So 3 are already. Now you can also start PhD program for medical physics. So it is very good actually. So paper also you can produce. You can do. You can collaborate with us. You come. We have lot of patients. We have lot of things to do it. We can analyze. I mean, for blood irradiation, whatever. All those work we can do. So all we are doing actually blood irradiation also we are doing. So a lot of things we can do it hearing and for research purpose also.
Okay. Thank you, sir. So
I want to add
yes,
in
please,
this
please. Yes, please.
that as I said that in our government colleges, we need to take teaching thing also. We need to take some classes of our MD students, and we also the co-guide of their thesis paper.
Oh, that's really good.
They are
yes.
research, and we are the co-guide of them because, as I said, we are the backbone of the department. So without us, any paper or any research work is not possible. If it is dosimetry or it is clinical, they need our help. We are the backbone. So they need our help. So we are the co-guide of theirs.
Okay. Okay, so I want to go to Dr. Dev once again regarding our course in Adamas University. Some of the students actually asking that is this course open for international students? Will it be fully funded or something like that? Is there
Well,
any guidelines?
let me answer this question. As you know, I don't know whether the students know or not, but Jadavpur University course is already open to international students. So to make any course available or open for international students, the organization need to take an approval from MHRD.
Mm-hmm.
So if we receive any formal application or query from the international students, so definitely our plan is to open this for international students. So as this year, we just opened this program, so we have not started this procedure. But if we receive query from international students, if their results are good, if they show they want to join us, then definitely we will talk to our vice chancellor and we will proceed. It's a simple process, but it takes 1 or 2 months of time. We will have to take the permission from MHRD so that they can join here as a student.
Okay. So another question to you once again that some of students are also asking that is this level equivalent to a professional practitioner certification or so, I'm sorry, is it just a formal education?
No. I think now after listening from Dr. Alok Kumar and Ipsita Madam, both, I think the students have already understood that this is completely a professional training program. When at the end of 2 years, you are hearing from the medical physicist and RSO themselves.
Hello? Am I audible?
Job-oriented
Yes.
program where people get trained to become a professional. So this is a completely professional program and this is approved by AERB. So I would say it's a very good, wonderful opportunity for the students to go ahead.
Okay, thank you, ma'am. So once again, I will go back to Ms. Chakraborty. What advice would you give to the individual interested in transition from academia to industry or clinical setting? Because you are from academician, right? Academic background. So now you are in hospital. So what advice will you give?
Actually, when I started my job, previously you have to set your mind, because being a physics student, your mindset is not ready to accept to see those kind of patients who are completely dying. Cancer means previously we are thinking that they are dying, but you have to set your mind such a way that you will help them to be in the life. You will be the one who help them to have a good disease-free life. This will take some time to set up your mind, to see the cancer patients. Lots of different types of cancer patients is there. They may be a child, they may be 80 to 90 years old person. So first of all, you have to set up your mind that you will be able to handle this thing. When I am in this field, previously, I cannot take this thing. I am in the teaching, I am from the teaching background. And then again, when I am joined the hospital, I see such a lots of patients in front of me. You have to set your mind first that you can handle it. You can, and gradually you will be able to handle this. Once you can understand that you are the one who will help them to have a disease-free good life, then only you will enjoy your job. I enjoy my job fullest. I enjoy my job fullest. This is such an exciting job, such a challenging job, because you know that depends upon your plan. Doctor is doing the contouring. You need to do the plan. And based on your plan, a patient will be treated And when you heard from a doctor that your plan is very good and patient is okay, patient is fine, he is now completely disease free, this will give you immense happiness. I can say this will give you immense happiness. And when the patient, after that treatment, they will come to us and say, ma'am, I am okay, I am fine, I am all okay. You know something, the child patients will literally bring some chocolates, balls, cars to make them take the treatment because they don't want to take the treatment. They are scared. And it is also our job to understand them, to make them understand that I will give you a car, I will give you a toy. You just lay down and take the treatment. And when you will be fine, this will give you immense pleasure. So I will say every person who are in completing his M.Sc in physics, they may come in this field, not only for the salary, which is sad said that sky is the limit, but for the sake of immense happiness, what you will get after completion a good plan or after seeing a cancer patient is disease free because of you. That only I can say.
Really nice to hear from you. Really encouraging these things actually. So, in this context, can I ask you, so can you share some examples of some non-traditional career paths or industries where individuals with a background in this medical physics or radiation safety can find employment opportunities?
Yes, besides the hospital job, one can opt for the hospital job. Otherwise, he can opt his career in different industries like Electra, Varian, Philips, in their R&D department. Not only that, some of my colleagues, I cannot remember just now, he joined Tata Mumbai as a scientist C.
Wow.
As a scientist, just 1 year ago, he left the West Bengal government job and joined there in Mumbai. He's joined as a scientist C post. So lots of opportunities are there. Lots of opportunities are there. Only thing is that you have to capable yourself such a way that you can switch here and there.
Okay.
You can be able to switch.
Okay.
That's up to you where you want to switch your career. Lots of opportunities are there.
So there are still the job opportunities in government sector also, right?
Yes,
in this line?
In government, in this line, as I said that till now, post in our government sector, 60 number of posts is created, and we are only 36 because we cannot find the capable one. Because in government, in West Bengal government, the post is physicist cum radiation safety officer. So one person, not only medical physicist, he needs to clear the RSO medical certification course. Then only he will be able to join or apply in the West Bengal government jobs. And vacancies is there. And I must say the perks, I mean the salary which I get, lubricating salary. I am a group A graded officer, and I am getting the scale of the associate professor, and I will retire. When I will retire, I will get the professor scale. The money is not a number of things. I cannot say exactly the money, but it's a lot.
Okay, so outside West Bengal also there is a good opportunity for the government sector, right?
Outside of is there in government sector, outside West Bengal,
West Bengal.
there is opportunity.
Yes.
In West Bengal also, central government opportunities is there. CNCI, they have created 2 centers. One is in the new center is in Rajarhat New Town. There is also lots of opportunities.
And these are central government.
These are central government sectors.
Okay.
AIMS Kolkata just has started. There is also a scope of medical physicists and RSO. So vacancies are there. You have to capable yourself to be on that vacant place.
Okay, thank you. So now may I ask Dr. Kumar that in your first discussion, you have mentioned about the nuclear medicine. So can you please explain a bit about the nuclear medicine? Is this related to the medical physics?
See, the job opportunity, actually, it is very limited there in nuclear medicine. So in nuclear medicine, generally, there are a doctor and a technologist. So technologists are doing maximum job of radiation safety. So once you give the therapy, so in the therapy, generally direct medical phases are required. So in the nuclear medicine case, we are giving very limited, therapy. So in Netaji Subhas Bose Cancer Hospital, we have therapy also. For nuclear medicine, we are giving iodine 131 for the thyroid cancer patient. Okay. So, but nowadays what happened? So there is some conflict between technologists and AERB. So they have done something differently. So maybe in the abroad, they are medical physicists are working in therapeutic case, but in India is very, very limited. So nuclear medicine is a kind of thing actually that give the, functional study of the organ. Okay. So they are using radioisotope, but doctor and technologists are working fully over there. So medical physics is not required. It's very limited. So, but definitely once this is ionizing radiation we are using here. So this is it is in core school curriculum because a student should know. But job opportunity is very, very limited throughout the world. I am telling you for medical physics. Okay.
Okay. So,
But in diagnostic radiology, there is a quality assurance program. So, because suppose a person actually, suppose a person X, Y, Z, any person, suppose they want to open one X-ray unit. Okay. So here they are using the, ionizing radiation. So once they are using the ionizing radiation, AERB has imposed some certain rules that they have the TLD badge person monitoring. Then their machine has to be quality assured. So who will do all the quality assurance program by radiation safety? So who will do actually? So suppose XY person, suppose any person is going, so they cannot appoint a medical physicist. So what happened? They have done some, service provider. So AERB has developed a service provider. So I was also have sometime service provider. So I was as a medical physicist. I open and work as a service provider company. Okay. So I used to do quality assurance program throughout the India. So suppose per machine, medical physicists will go and they will do the quality assurance and they have to buy their own equipment. Suppose beam alignment devices, suppose KVP meter. So all those unit I have to purchase instrument and I have to get recognition from AERB. Then I will become the service provider. So medical physicists can also be a service provider. They can do quality assurance program. They can open their own, service providing company. So I already used, and I have done so many machine quality assurance for medical college, government of West Bengal, and RG Government Medical College. So many places in India. So now I left that job now. So I am telling you this is the kind of job opportunity of the medical physicist also. But in diagnostic radiology, AERB has given such type of opportunity. So the medical physicists, if they can open a service provider company, they can do it.
Okay. Sir, can I ask you something once again? So,
Yeah,
for
please.
students or professional considering a
Oh.
career in this medical physics or radiation safety, what resources or network opportunities would you recommend to help them explore and pursue job opportunities in this field?
See, I told you, initially I told you, madam, that
Can you please
two,
repeat
three
once
things
again
actually.
for the students because they
Yeah,
are
no,
willing
it's
to know?
okay. No.
Yeah.
See, at this stage, I am still learning. I am telling you. And, there are a lot of job opportunities coming up day by day. You cannot imagine. What are the job is coming nowadays. So there are a lot of opportunity. Now outsourcing has come up. Now outsourcing is a different. I am telling you. So I am working as an outsourcing company. Suppose in India also there are a lot of hospitals have outsourced their radiotherapy department. They have outsourced their diagnostic department. So medical physicists is able to do all the job there. Na? So job opportunity are there in their outsourcing company also. Understand? So
Yes.
outsourcing. So job opportunity very, very high nowadays. I am telling you. Initially it was very limited. So now online has come up after Corona. So online has come up. So I am sitting here, I am doing a lot of job of the America also. Even in Hyderabad, now the treatment planning has performed in Hyderabad. Do you know Hyderabad is a hub nowadays? So they are doing treatment planning of the US hospital. And they are doing the planning and they are sending the treatment planning and they are approved by the doctor. So there is opportunity like anything. Now they are asking 100 medical cases. They require 100 medical cases. Government is very, very limited nowadays. Government, I am telling you, only in West Bengal, government people are telling. But if you go outside, government department is there, but plenty of hospital, even government is giving, even West Bengal is giving outsourcing they are doing nowadays. That this department, some department or the department have been outsourced of the West Bengal. I think if Sita will tell better to me, there are a lot of hospital. I think some hospital has been outsourced already. Even the CT scan is outsourced of the West Bengal hospital. So who will do all the quality assurance over there? Definitely service provider, definitely medical physicists. So all that job opportunity coming up slowly, and it is, I'm telling you again and again, it is sky is the limit. So you have open this, course there. I am telling you, your student will get the job. They are not a good teacher, good medical physicist, good amount of salary, well satisfaction. If they are working in a cancer field, they will satisfied. Suppose they want to do some charity job for the patient, for the cancer patient, they have the full opportunity to serve the patient. I'm telling you, serving the patient. Suppose you have some soft corner for the cancer patient. You come and treat your patient. You be satisfied. And radiotherapy is a teamwork. I am telling you, doctor, medical physicist, and radiation technologist. Three are of the teamwork actually. All three work together cordially, then definitely you will be happy to treat your patient. And your patient nowadays, cancer is treatable nowadays. In the old age, we have some old time, we are thinking that he is having cancer, then he will die. But I am telling you, more than 60-70% patients are curable, 100%. I am telling you. So it will also give you satisfaction once you are treating the patient. If you are in the radiotherapy department, if you are diagnostic radiology department, you can have service provider company. If you are nuclear medicine department, you can do the outsourcing. If you are in a company, what if you are told Varian company and Electa company, Electa company, they are the manufacturer of linear accelerator. So all those they are taking medical physics as application specialist who will explain the application of this complicated sophisticated machine. Definitely medical physics. So there also medical physics required. They are taking, and nowadays it is a global. So patients are coming. We have a lot of population. So definitely patients are coming. More patients are there. More hospitals are there. So day by day, more maximum hospital. Government is also investing money in the health sector. So a lot of opportunities coming up, I am telling you. So there is no doubt about it. It is 100% better if you are doing medical physics professional course. This is a 100% professional course. After passing, you will have job. You pass, you will have job. Directly, you will get job. Directly, you will get radiation professional number. So once the medical physics course will completed, you have to apply, the student has to apply to AARB and they will get their radiation professional number. So we have our radiation professional number as a medical physicist and as per our qualification. If I have passed RSO examination, then I can work as a medical physicist and RSO in any hospital. If I have not passed RSO, I can work as a medical physicist, and that professional number is given by Atomic Energy Regulatory Board after going through your academic, you're going through your degree and diploma. So once you got the RP number, you can work after passing it. So I use a professional course. From day one, you can work. Even my one or two, three people just passed from as an intern. They are working. After passing, they are working. In Indira Gandhi Institute, one of my students, he is associate professor. One is medical physician. Lot of, even if Sita is also my student now, she is very good, she is very happy. So all our students are getting jobs. So 100% job opportunity. But nowadays it is bit, competition is here definitely. So we have to compete it. That's all.
Okay, thank you, sir. Ms. Chakraborty, will you want to add something?
So no, nothing else. But yes, lots of opportunities in this field. Once again, I am telling, as Sir said that doctors have their registration number after completion their MBBS degree. Similarly, we also get a registration number from AERB. As Sir said that the same way that if I am a medical physicist, I will have a RP number. If I am a RSO, I will have again a RP number. And that RP number is our registration number also. So again, I am saying this is a very challenging field, very nice field. Money is there. When it is a professional course, everyone must think whether he could earn money. Money is, but yes, in this field, everything is there. You have to love the field. You have to love the subject. And not only you lived your mother subject physics, you
Yes.
are with physics, but you are applying that physics in a other field. In medical science, in radiobiology, you are applying your physics.
Definitely. Thank you.
So
Thank
very
you, Ms.
nice.
Chakraborty.
Thank you.
From my end, actually, I want to continue this discussion, but maybe my other colleague have some questions. Or maybe the participants. If you have any questions, you can write down in the chat box so that we can read and.
But I don't think they have any further question because the discussion was so vivid and rigorous.
Yes, yes.
That now they know about everything. That is starting from the very basic, what I said, what is the eligibility criteria,
Yes,
from
yes.
what is medical physics, what is the job opportunity, what are the options after they pass the course. There are two, I mean, what they will do after becoming a radiation professional or an RSO, they have to clear. So I think now they have got the answer of all important questions.
Yes, I also believe so. So,
But
but
still,
still,
I mean, if they have any
if
questions,
they have any questions, and also if any of you, my colleagues, if you have any questions, so please. Two experts are with us, so this is a golden opportunity. We have really learned a lot. We don't have any so far so many ideas.
I don't think now they are having any questions because all have been already answered.
Yes, so let's.
I think we have given more answer to you. We have given more answer to you. What you have asked, I have given more answer to
Yes,
you. I can give a lot of
sir.
example. And a very good course I am telling you, you have opened it. And moreover, I will suggest also one more thing actually. You open nuclear medicine technologist course. Scarcity is very, very high. And their initial salary is 1.5 lakh, I am telling you. So this also you please keep in your mind.
Definitely, sir.
Yeah, so scarcity, there are a lot of departments, they don't have medical technologists, nuclear medicine. So it is very much needed actually. So this also is 100%, 200% job opportunity is there. And this definitely medical physicist job opportunity. So you have plenty of this. You will helping to the student. And I am very much satisfied to open such type of course. Now I am very much happy and satisfied because a lot of, here, especially Bengali students are getting job here, 100%. This is my satisfaction. So I can say I have opened Jadavpur University course. Now I will say I will help you to open because you people are very, laborious and sincere. Especially your team, madam teams, Momita madam teams are excellent. So definitely this course will be very nice, excellent. I will always with
Thank
you.
you, sir.
And
Actually, yeah, without your initiation, we wouldn't have thought
Yes.
about it. But I'm really happy that apart from the conventional physics, now we have done something where actually our students have very good job opportunity because physics will always be there. We all love physics, but still there are some things, some job-oriented programs are also essential.
Yes.
So I'm very happy that we have opened it, and this discussion was extremely needed because sometimes students were asking some questions about the program, and we being I being a completely theoretical physicist, answering those questions would sound a bit of false. So you people answering their questions and queries, it is very good. So thank you very much for joining us, sir. And thank you very much, Ipsita. I think someone has asked a question. Um, there is chat box. One question is there. Let me just
Yes.
answer.
I'm reading the
All the
questions.
practicals covered, which is included in the RC syllabus. Definitely, yes.
Yes.
Okay, and so this question let me answer. There are total around 34 number of experiments, and not all the setups are there in university because it is not possible to have it in university, and that's why the university has signed the MOU with NCRI Institute or NCRI Hospital. In the first semester, we will perform here in university around 10 experiments, and the rest of the experiments will be performed, or you will learn about those experiments in the second semester in the hospital itself in practical classes. So we will cover all the experiments. That's the assurance which is given in the list by BARC. So I hope your question is answered.
There is
Yeah.
another question in the
Another
chat box.
one, yes. May I please
Yeah.
know the list of companies where a medical physicist can work other than the hospital setups? I want to know where are these companies situated in India?
I think Ipsita or
Ipsita has already.
Dr. Alok Kumar, sir, they can answer this question.
Yes.
Yeah, I'm telling one, two things. Ipsita also told Electa and Varian. I
Mhm.
can name so many companies, but count and retain is bit difficult. So Varian Medical System, you can just type in the Google, you will get it. Electa Medical System, you can Google it. PTW, you can Google it. IBA, you can Google it. There are a lot of companies, radiotherapy department, diagnostic radiology, Philips. So a lot of medical, wherever ionizing radiation. Once it is used by ionizing radiation, those companies who produce X-ray or radio handling radiation isotope, in those companies you can get job as an application specialist or maybe some other part. They are medical physicists are working. This I can say because writing all those companies is a bit difficult.
So, Ms. Chakraborty, will you want to add something?
No. I want to add the name of Siemens. Siemens is also applied.
Yes, I have heard about it. Yeah. So I think you have got your answer. Is there any more question?
No, I don't think there's any. Some
So-
people have. Can other state students apply
Yes,
as well? Yeah,
yes,
obviously.
definitely.
We have already received many applications, and I can say around 50 to 60% applications are outside West Bengal.
तुम्हें तो बैठी है.
Any student can apply as long as you have a BSc in physics degree and 55% marks minimum in MSc physics level.
Okay.
So can you please tell this participants how to apply actually? What is the process of applying for this course in Adamas
Okay,
University?
so if you want to apply,
हम निकल जाते हैं.
yeah,
Excuse
I
me.
have already given a link in the chat box where all the details are given, and you can contact any of us in the department. You can send us a mail or call, or if you can just write Adamas University, there are apply now section is there. There also you will get the option of post-MSc diploma in medical physics. So it is there.
Okay.
Or any sort of query.
1 minute. Can I leave? Can I leave? I think I have given all my answer. So I have
Yes,
some
sir.
job
Okay,
actually.
So we
okay.
are about
Thank
to
you.
end
Okay,
the
thank you
session.
very much.
Thank you so much for
much.
joining.
Thank you.
Okay, thank you. Bye.
Thank you.
Another question. So can you please let us know about the age limit for this type of job? Ms. Chakraborty, maybe?
I think Ipsita would be best person to answer this.
Yes.
Ipsita, are you here?
Yes.
So can you please let us know? Yeah.
Actually, in government, it is 40. But for private, no age limit is there because one of our medical physicists, one of our senior, after retirement, he has joined a private institution. So for private, no age limit is there. After retirement,
Ipsita, I have one question in this regard. As you talked
yes,
about, there are 3 attempts in RSO examination. So is there any age limit for appearing in RSO examination?
No age limit is there, but only 3 attempts you can
Attempts
do.
are there.
Okay.
Okay.
There is another question in the chat box.
Okay, now people are asking, people have started to ask questions. There will be any job surety at the university?
The university will take the responsibility.
Well, I don't know how to take the responsibility from the university, because after giving you the certificate, you will be given RP number, that is a radiation professional number from AERB, and then you will be absorbed in any hospitals, or as you heard the entire lecture. So university cannot take the responsibility because they have already prepared you and you will be given a job 100%. But definitely we will try to contact some hospitals if needed.
But
But
they
I
have
don't
to.
think it will be needed. But I don't think it will be needed. They will already get it.
Yeah, they have to pass the examinations.
In fact,
On-
Ipsita can talk about it.
Yeah.
When she passed from Jadavpur University, how did you join Ipsita? Because the student is asking, is the university going to take the responsibility? So was the job given to you by Jadavpur, or you just applied
No,
to?
Jadavpur has not given me the job.
Exactly,
Jadavpur made
because it is beyond the capacity of the university.
yes. Jadavpur made me capable so that I can arrange my job myself.
So
on
you have
my
to send
own.
your CV to other
I have
hospitals and you
cleared
have to
the
apply.
degree. Exactly. Jadavpur made me capable.
That's our job also as a university.
Exactly. That's job also. University's job is to make capable a student. But to have the job, that depends upon solely on the student. He need to clear the examination.
Are there any specific books to prepare and crack for RSO examination? Can we find any mock test or previous year question papers? Ipsita, you can
No.
answer.
No. RSO examination question paper, we cannot have any kind of RSO examination question paper because they don't give it. No previous year question paper is there. The thing is that you have to ask it for your senior. What we have did after completion our RSO examination, in the night time we have written the question for our juniors so that it may help them. The only thing, you have to read the books completely. You have to make your knowledge in such a way that what kind of question is there, you have to answer it. And in Viva, anyone don't know what they will ask. Exactly 10 to 12 eminent professors will be there, and you have to stand in front of them. They will give you a chalk or a whiteboard marker and ask you questions. So no one know what question or what bombardment he will be faced. All will be in a locked door. The person who is just standing outside, he also don't know what type of question is asked to his previous one. So no question paper is there. But with our experience, we can say that study this part very well, study this part very well, and you need to follow your syllabus, the syllabus which is given by AERB for the RSO examination. Everything will be from that syllabus. You have to read that syllabus thoroughly.
Thank you.
Another question is there regarding the foreigner
Yes.
joining this school.
So now Abhishek Ranjan is asking how much total applied application.
No, there is another
Abhishek,
question.
I've seen. I'm going to answer that. So Abhishek, I don't think I can tell it right now because we are still taking the applications. The last date of application is 15th of June 2024. So we are expecting a good number of applications. So I know you have applied. I have seen your name. So it will be a good competition. Keep your preparation good. And yeah, you have also applied. No, someone else has also asked, what about the scholarships? There is no scholarship. There's a difference between scholarship and this fellowship. Yeah, during internship, sometimes you will be getting a fellowship amount. Now that exactly depends on the hospital policy. If it's a private hospital, then the stipend you will be getting depends on the hospital policy. If it's a government hospital, you won't be getting any fellowship, but I'm sure you will be learning a lot. And then after 1 year, everything is covered. I guess, Ipsita. So, isn't it, Ipsita?
So someone
Yes.
has asked, I'd like to ask if
Any
foreigners
provision of
from
stipend?
South Africans are eligible for this program, and if they are for
No, from South Africa, as I said, you have to send me an email to the ID hod.physics@adamasuniversity.ac.in. I have already sent a flyer, a one-page PDF file in the chat box. You just send me a mail. We will have to talk to Vice Chancellor and MHRD to get the official approval for that, because for international students, now there is some specific rules by Government of India. We have to follow that. Definitely, it can be arranged. So
so
send me
maybe next
official.
year, from next year, we can
Yeah,
accommodate.
we can do that, and we will do that. Jadavpur is doing that. Why not us? So obviously, we will do that, but we will have to go through some official procedures for that. Now someone is asking any provision of stipend during 1 year course. No, it's just 1 year. You will be attending the classes in hospital and university, and the second year is internship. In the first year, there is no stipend for the student. How does this course differentiate itself from the similar ones offered at other institutions in the same city? Okay, that I think obviously I will say the syllabus is same. So the first difference with JU course that is being offered here, I would say in Jadavpur, the timings are different. You will be attending an evening classes. For us, it's a full-time course, regular course from 9:30 to 5:30. And in our university, there is a trend, not only for this PG diploma program, there is a trend that during the weekend, we prepare our students for competitive exams. For example, those who are attending this M.Sc Physics now, they can tell you that those who are interested, we are preparing them for NET examination. So similarly, in our university, we have a plan, our Vice Chancellor have a plan that we will be arranging some special classes, some guest classes, guest lecture sessions, or master classes for this particular RSO examination training during weekends. So I'm sure this will be a first time, this will differentiate our program from Jadavpur University's program. And not only that, I shouldn't say about it, but let's see the quality of teaching and the practical that we are going to take. Let's see what is the quality of that. I hope it will be good as Jadavpur, and there will be some extra classes as well. For now, I'll be saying this much. Is there any other question?
Yes, from Abhishek Ranjan once again in the second
Yeah,
year.
Abhishek also asked me this question over phone
Can-
also.
Can I do
during second
internship?
year, can I internship? Yes, Abhishek. If you can arrange that internship from a hospital by yourself, you can do that. And if that hospital is affiliated by AERB, if they have all the experimental facility that are given in the syllabus of AERB, then why not? Bonisha, you are going to say something?
Yes, ma'am. Sorry to interrupt, but actually 90% of my data has been consumed already, and I don't have enough internet to continue the meet. So can I leave, ma'am?
Yes, Bonisha, absolutely. Thank you for joining.
Welcome, ma'am, and thank you too for inviting me in this meet and giving me a golden opportunity to know about the medical physics.
Yeah, I'm sure it was new for you.
Okay.
Thank you. Thank you for joining. Okay, now if there is no further questions, so I think it's time to end this panel discussion now. Dr. Alok Kumar has some emergency probably. He left the meeting. And Ipsita, thank you so much for joining us. And hopefully we will be seeing you in the campus as well for some guest classes. Let's arrange for that. I'll arrange for that definitely. I do. Now people are keeping. Now your discussion was so good that the question answer session is not going to stop. Now someone saying session was informative as well as that. Thank you so much. Thank you so much to all the
thank you.
participants and to our esteemed speakers as well.
Thank you. Thank you.
Thank you, Purba, for moderating this so wonderfully.
Thank you so much. Let's thank all
Thank
the
you. I
participants.
will answer your question, and now you can call me. You have my number. Call me, and I'll answer rest of the question. Otherwise, there is no point for. Okay, you are answering, you are questioning, and I am answering. There is no point.
This is
of
a never-ending discussion, actually.
Okay. You call me, I'll answer.
Okay. Thank you, Ipsita, for joining.
Thank you, everyone, for joining. All my colleagues are here. Dr. Papia Dhara, Dr. Dipto Shikha, Dr. Tamal Kumar Mukherjee. In fact, this was the brainchild of Tamal sir. Dean sir was here because of some urgent family reason. He had to leave this meeting. Aparajita ma'am is here. Shamna sir is here. Thank you so much to all the participants, to all the students, and to everyone, Ipsita, including you. Thank you very much, because this is comparatively a new domain for us. Although we were trying for last 2 years to get it open, but still this was very new. So we also learned a lot. Thank you very much.
Thank you. Then I am leaving.
Thank you. Okay.
Thank you.